A multi-million-dollar healthcare strategy was announced today by the province. The money is going to be spent on hip and knee surgery with an almost 2-year waiting list. And while some health groups applaud the announcement, others wonder who's going to staff it. The CBC's Richard Madden explains.
Dr. Victor de Krompe is in huge demand. He's one of just 41 orthopedic surgeons in Manitoba with the skills to perform hip and knee surgery. A skill in short supply, which means some patients have to wait almost 2 years to get an operation.
It's awful. It's bad for me. It's much worse for my office because they're being called all the time and saying, like, when am I being done? Why do I have to wait so long? And I don't have it within my power to, in fact, speed it up.
We know we have much more to do.
But the province says it can cut that wait in half by redirecting $10 million healthcare dollars it received from Ottawa over 2 years.
This will, we believe, allow at least 1,000 additional procedures to be done to peel our waiting list down to a more acceptable level.
It will spend the cash on expanding surgeries, increasing the number of doctors, nurses, and improving diagnostic equipment. Health authorities will then ensure urgent cases are seen first.
It really is trying to prioritize patients, sorting out where they are on the list, making sure that we don't have slippage for people that require more immediate care.
But like other provinces, Manitoba is facing shortages with several skilled health professionals, at least 14 orthopedic surgeons, anesthesiologists, nurses, doctors.
You can't just throw money at it. You have to throw personnel at it, like nursing staff has to be there in order to do the total joint replacements. There have to be enough surgeons to do it. There needs to be then enough physiotherapy and various things like.
There's also shortages of available hospital beds and operating room space. But Winnipeg's health authority insists staffing is improving and hospitals can accommodate the surgery space.
Between the 3 sites we're talking about, we shouldn't have trouble accessing OR space. It'll be anesthesia and the required beds and rehab that kind of probably set the limits.
Dr. de Krompe thinks an improvement won't be seen overnight, but he says the current wait is unacceptable.
If we can just tackle this and get the numbers down to a more manageable point, from then on, you can sort of hit a steady state.
The province agrees, but with an aging population and medical equipment becoming more expensive, the question now is how much more will be pumped into orthopedics when the cash is spent 2 years from now. Richard Madden, CBC News, Winnipeg.